Today, we will be discussing central line placement into the internal jugular vein. A central line is a flexible tube inserted into a vein that stays in place long term and extends to the superior vena cava to deliver products including medication, blood, and nutrition directly into circulation. Those receiving a central line may be in need of emergency venous access, nutritional support, volume resuscitation, or administration of caustic medications. Absolute contraindications to central line include distortion of local anatomy and infection at the insertion site. Before you begin your procedure, gather the tools shown above. Gown and glove to ensure that you are sterile. The patient will be sterilized with a sterile prep solution such as chlorhexidine and draped with a fenestrated drape. They will be tilted downward by 10 to 15 degrees. The area will be anesthetized with 1% lidocaine, and you need to ensure that you work all the way down to the vein. Enter with the needle at the top of the triangle formed by the clavicle and the sternocleidomastoid muscle. The carotid artery and internal jugular can be identified by ultrasound. The internal jugular will compress. The soft tissue will tent on ultrasound, and then you will see the needle puncture the internal jugular. Once you're in the vein, aspirate blood, remove the syringe, and put your thumb over the end of the needle. Insert the guide wire into the end of the needle gently until you meet resistance. Keeping one hand on the guide wire at all times, remove the needle and ultrasound the area to ensure appropriate guide wire placement. Using an 11 blade, widen the incision where the skin and the wire meet. Insert the dilator over the wire as far as it will go. After the dilator has been inserted as far as it will go, remove the dilator. Using gauze at the base of the dilator where it meets the skin will reduce the amount of bleeding after removal of the dilator. Once the dilator has been removed, slide the central line apparatus over the guide wire and gently into the skin, all the way to the base of the central line device. The guide wire can then be removed when the central line is placed appropriately. Secure the outer portion to the neck with sutures. Appropriate placement of the central line should be determined by doing a chest x-ray immediately after the procedure. Complications of a central line include infection, thrombosis, dysrhythmia, injury to the vasculature, venous air embolism, and bleeding. For patients leaving the hospital with the central line, it's important to keep the area around the line clean and dry. They should also pay close attention to the line and ensure that there are no signs of any problems such as cracks, leaks, or signs of infection such as redness. Patients should also avoid lowering their chest below the waist, such as tying their shoes. This can cause the tip of the catheter to slip out of place. Patients should also notify their healthcare provider if they happen to vomit or have severe coughing, as this can make the catheter slip out of place as well.